and having our partners from New Life International Church and Crescent Avenue Baptist Church, along with members of our synagogue, is an incredible blessing. And that we're able to build our relationship through honest discussion around race at a time when so many others want to use race to sow division is not something that I take for granted. Jews around the world have a calendar of Bible readings that we follow. Each week, we read 1/52nd of the Torah, approximately, one part of the 5 books of Moses. And over the course of the year, we complete the whole thing. And we also add in other readings from the prophets and the writings. But this week's call from the book of Deuteronomy was written for tonight's program. You shall not show favoritism in judgment, small and great alike shall you hear. You shall not tremble before any person, for judgment is God's. Summary here is, judges should not play favorites. What a simple line, but what power. You should listen to the small ones, the people some might consider marginal, in the same way that you listen to the so-called big ones. Why? Because judgment is God's. When human judges judge, they are doing so only as God's emissaries on earth, as God's partners. I'm thinking about the late Congressman John Lewis tonight. He once said a sentence that could have been a comment on these words from the Torah. He said, "Nothing can stop the power of a committed and determined people to make a difference in our society." Why? Because human beings are the most dynamic link to the divine on this planet. What a gorgeous line. Human beings are the most dynamic link to the divine on this planet. What that means is when we judge, we are doing God's work. So we better get it right. This verse from the Torah refers to court judges, but I think it can be understood as any situation where one human being is in a position of some authority or power and must decide something that affects other people. When 2 students come to a teacher and say, "She started it," when children come to a parent and say, "It's not fair," when government officials must allocate resources, in all of these cases, says the Torah, listen to those so-called small ones in the same way you listen to the so-called big ones. Actually, I think what it's really saying is that there's really not small ones or big ones in God's eyes. That's a fiction that we create, maybe we need to create, but God doesn't see it that way, because God remembers that we're all created in God's image. No big or small, no black or white, no Jew or Christian or Muslim, no man, no woman, just a bit of God's image walking on this earth. And as a bit of God's image walking on this earth, every one of us deserves a fair shake. Tonight we'll talk about healthcare disparities, places where people have not received a fair shake. And I imagine that there will be statistics which are important, and I imagine that there will be theories which are important, and there will be opinions and feelings which are important. But as we talk, I hope that we can also try to have God's perspective, that every person, whether we think they're big or small, whether they see themselves as important or not, deserves access to healthcare. We're all equal in that way. And as a society, we have to work hard to be worthy of the task that God entrusted us to judge, to decide, to allocate, to legislate, to adjudicate without playing favorites. And when we see that we're off the path, then we need to judge better, to take care of each other with more love. Congressman Lewis said that freedom is not a noun, it's a verb. He wrote, "Freedom is not a state, it's an act. It's not some enchanted garden perched high on a distant plateau where we can finally sit down and rest. Freedom is the continuous action we must all take, and each generation must do its part to create an even more fair, more just society. Freedom is not a state, it's an act. Justice is not a state, it's a striving. Equality, as we too know, is not something that just exists. It's something that we must reinforce and build and strengthen and nurture each day, because if we're not doing that, then equality shrinks. Equality disappears. I believe that the Torah calls on me. I believe it calls on every person to do part of this work. As God's partners, Jewish tradition teaches us that it's not up to us, any one of us, to complete this work, but neither are we free to desist from it. Because, as Congressman Lewis said, we are the most dynamic link to the divine on this planet, every single one of us. And that is an awesome responsibility. And we each need to take care of the other links in this chain, lest it break. I want to thank you all for being here.
So much, Rabbi Katz. Words, important, powerful words, and also for your leadership in these very difficult times on so many levels. I'm Miriam Westheimer. I'm on the committee that has helped plan this series. And before I introduce our speakers, I just want to lay out sort of the plan for the evening. We're going to have a fascinating dialogue, I know, from watching the emails back and forth. And then we're going to go into some breakout rooms and have some smaller conversations with facilitators who have some questions. I want to give a very warm and special welcome to members of Creston Avenue Baptist Church and New Life who may be joining us tonight, with a special shout out to Anthony Dunn and Edward Callahan, who from Creston Avenue Baptist Church, who helped frame this evening's conversation and questions. So two people who will be speaking to us are incredibly accomplished and impressive individuals, and they're also friends in our community. So it's such a delight to be both very familiar with both of them and to consider them both close friends, and also to be able to listen to to people with such history and accomplishment and perspective. Professor Philip Alkabis is Professor of Public Health at Hunter College, City University of New York. He's an epidemiologist by training and has done extensive research on HIV/AIDS and other community health problems. For the past 20 years, he's been teaching and writing about social determinants of health. And this year, he is writing on the coronavirus outbreak for the American Scholar. He has a podcast and his articles, and those are all available on the CSAIR website resources for these conversations. Councilman Fernando Cabrera is no stranger to CSAIR. He has served as New York City Council member representing the 14th District in the Bronx since January 2010. His leadership positions in the New York City Council include chair of the Governmental Operations Committee and co-chair of the Gun Violence Task Force. Council member Cabrera is a member of the Black, Latino, and Asian Caucus and a staunch advocate for tenants, youth, and seniors. Councilmember Cabrera is also senior pastor of New Life Outreach International in the Bronx and is a former program director for the mental health and counseling program at Mercy College. It is my deep honor and privilege to turn this program over to Professor Alkabis and Councilman Cabrera.
Thanks a lot. Let me first tell you what the two questions I hope we can address. They're big questions. And then I will tell you a little story, which I hope will be relevant to this wonderful teaching we just got from Rabbi Katz. So, two questions. One, what aspects of our system, the society we live in, the policies that govern us, are barriers against people of color, Black and Hispanic Americans, becoming as healthy as they could be? And second question, what needs to be done now? Of course, everybody wants to fix everything right away, but it doesn't work that way. So what needs to happen to make health in America available to all Americans? Okay, story. This is a Bronx story, and I think it has to do with Rabbi Katz's teaching about the big and the small, and this difficult question of justice. As Miriam mentioned, I was trained as an epidemiologist, and when I was a kind of baby epidemiologist, the AIDS outbreak started. So this story takes place a long time ago when I wasn't really a baby. I was a young man. And so this is the mid 1980s. And the AIDS had just been determined to be caused by a virus. We now call that HIV, human immunodeficiency virus. But AIDS was well known in those days as being a disease of relatively affluent, mostly white, gay men. That was the reputation of AIDS. Such people were not well received in American culture, and that tension was the source of a lot of upheaval. But in the Bronx, people knew very well by 1984 or 85 that AIDS was a disease of people who injected drugs and spread heterosexually to their wives, girlfriends, boyfriends, lovers. So this is the background. So the background, that's the background. In this story, I'm like young Phil, young epidemiologist Phil, is riding the 4 train, either to or from Montefiore, I can no longer remember which, with a friend who was also an epidemiologist and just a few years ahead of me. I said to the friend, what's going to happen with this? And he said, and this is the significant thing, he said, over time, it's going to do what all infectious diseases do. It's going to become a problem for the poor, and others will forget about it. And over the next 25 years or so, that's basically what happened. Well, why is it? You know, he didn't actually have a crystal ball. He's a smart guy, but he couldn't actually know this. How did he know this? Well, because that indeed is the story of contagion, and that viral diseases like the one we're seeing now especially become problems of the poor and often get forgotten about once that happens. So the question I want to ask is, clearly it's not just about being poor. With coronavirus, which the outbreak of which we're still living through, the death rates in New York City for Black and Hispanic New Yorkers were about 3 times higher than for white New Yorkers. Nationally, the death rate for Black Americans has been almost 2.5 times higher than for white Americans from coronavirus. The public hospitals in New York, we call them municipal hospitals, which are not exclusively treating Black and Hispanic New Yorkers, but are much more likely to do so than the private hospitals, have higher death rates. What are the elements of our society that make people, especially Black and Hispanic people, more susceptible? It's not just poverty. Poverty has a lot to do with this, but it's not just that. So what I want to ask is, what are the aspects of life in America that are the barriers to Black and Hispanic Americans being as healthy as they wish to be? In America today, almost a third of Hispanic children and fully a third of Black children live in poverty. I find that staggering. In a country where the gross domestic product, the GDP, does anybody know what it is? I'll tell you. It's $20 trillion a year. Trillion with a T, that's 20 with 12 zeros after it. That's $20 million a year. We can't figure out how to raise children not in poverty. Well, of course we can, but we don't. So why is it? What are the political barriers to what are the barriers of political will that keep us from addressing this very simple problem? I tell my students that America can't have a healthy public when we put so many people behind bars. Mass incarceration, I tell them, maybe they believe me, is a disease in the American public. 2.2 million Americans are behind bars at this moment. 2.2 million is the collective population of Cleveland, Cincinnati, Baltimore, and San Francisco behind bars. And as you might know if you've been paying attention to the news, many prison systems have had the worst point outbreaks of coronavirus. How could they not? People crowded into settings where they can't move around and there's no protective equipment and they can't escape infection. So last statistic. As of the most recent data I could find were 2018, 19% of Hispanic Americans already in 2018 did not have medical insurance, and more than 10% of Black Americans. That means, and that was in 2018 before people lost medical insurance because of the efforts of the White House, and before coronavirus made people unemployed, with an estimated additional 5 to 10 million people losing health insurance. So lack of medical insurance is particularly a problem of our Black and Hispanic fellow citizens. And what does that mean? If you, when there's coronavirus and you can't escape it, then, and you go to a municipal hospital, and first of all, you delay going to a hospital. If you go to a hospital because the ambulance takes you there, you hope they don't bill you. There's no way to be healthy if you can't pay for basic medical care, and we still haven't done that. So that's enough data. I think I'd like to ask I'm sure Reverend Cabrera has a few things of his own that he'd like to say, and I would really like to ask him, Reverend, what did you see happening, particularly in your congregation and your district after coronavirus arrived?
Well, thank you so much, Doctor. And I want to thank Rabbi Katz, my good friend for many years. As a matter of fact, I started to lose track how many years it's been, because I know our children were very little when we first met. And I want to thank the team, Miriam and Ben and everyone who helped us put this together in Creston Baptist Church and alongside with New Life. But you started with a story. I'm going to start with a story. My son, Joshua, I come to find out, and I was stunned because it was very early on. I didn't know anybody personally that had a family member or they had COVID-19. He was alongside with some of our leaders, our pastors in our church. I was not in that room. It was the day before our church service. And 2 days later, he got sick. All of a sudden, he got sick. My son-in-law got sick. Later on, my daughter, Lisette, ended up getting sick. I realized very early on that there were two systems at play. That people in my community were having such a difficult, this is hard to believe, such a difficult time to get access to testing And yet, just a few miles away in New Rochelle, they had a whole system set up. They had a system for testing. They had a system for tracing. They had the whole system for containment. And yet, after a week, I realized that there were no plans for tracing. Most clinic only had 2 testing kits for 2 people. That was the reality that we were facing here in the Bronx. And so it was not about, let's contain it. It was all about, let's see how we're going to stagger the cases of COVID-19. And as a result of that decision, we had at one point over 300 people dying in their homes. My district was one of the hardest hit in all of New York City. And there's many different theories. Part of it is proximity. A lot of people living right next to each other, having to go through, same building, same stairways, same elevators. You have multi-generational families living together in some cases. And then you add on top of that, all of the health issues. We're number 62 at all the counties in terms of health, our health situation here, which we have a lot of underlying issues in our district. And as a matter of fact, in the Bronx, why our people are not as healthy as other counties, which I'd love to address briefly. But we had a accessibility problem. We had a proximity problem. And then we had, like you mentioned, Doctor, you touched it lightly, a possibility problem. We didn't have the possibility that I could say, you know what, I'm gonna go to my cabin in the Catskills, or let me just move to my vacation home. And I don't blame people. I'm grateful that people had that opportunity for those, but we didn't have that luxury. So there was not that level of intense work taking place here. And then the mixed messaging that we were getting. First responders, they need masks, but you don't need a mask. And then we get people in government saying, you don't really need a mask. And now we know that's one of the most effective, simple ways to try to prevent the spread of it. So we had a lot of mixed messages. And then we had hospitals here. I don't know if you know, some of our hospitals here are literally on the verge of bankruptcy. You go to St. Barnabas, if something doesn't happen by September, they're gonna run out of money. They just don't have enough money. And I know we brag about Montefiore, they only have a couple of months worth of savings. So if they were not to get any more funding coming in, they only have enough money to survive for a couple of months, which is not a whole lot. We don't have the level of support. And then you add where you see a hospital like Montefiore Hospital, as advanced as it could be, but it's sustained by 15% of private insurance. People who have private insurance literally is carrying the hospital for the most part. And then that was shut down during, for a lot of those procedures. And so when you start having that complexity with high cases of obesity, diabetes, as a result of lack of healthy food, the kind of fast food that we have here. And for the record, I'm a vegan. And I can tell you how difficult it is here in the Bronx for me to get healthy food. When I go to City Hall, there is a vast plethora of choices. I come to the Bronx and it's just very difficult. So I see the disparity of supermarkets here compared to Westchester. I see what happened in New Rochelle versus the Bronx. Having things come to the Bronx last. And as you can tell, I'm not a happy camper when it comes to that. And let's talk about what's next. all of the people that are having these after effects. My daughter right now, and she tells me, Papi, sometimes I for 2 days I can't function because my mind is like all foggy, and she knows it's a result of, and many people are experiencing that. People with high elevator enzymes in the liver. I mean, we haven't even seen the end of it, and we are ill prepared to deal with these cases. And as a matter of fact, they're not even treating most of those cases right now. And it makes me wonder what's going to be the outcome of having such a, you know, lack of early intervention. So it seems like, I have to tell you, government it moves too slow for my taste, and to be honest with you, for what is so required and needed in times when we need leadership, in time when we need decisiveness. And I think that is what we keep seeing in communities of color all throughout the United States. People are not making decisions early on to be able to avert this pandemic from being spreading so quickly among us. Decisions that were made about the MTA came so late. Decisions that were made about public transportation. And it was like a grand experiment. Let's see what happens. Well, we know what happens. Just listen to the experts. And they know what happens. This is not a new phenomenon in the history of mankind. And so it baffles me. It is staggering to me that so many New Yorkers, especially people of color, had to die. You know, I used to get up in the morning, and I still get emotional. To get up every morning, I remember, and going through Facebook and wondering who died today. That was really very painful. I think some of us here in the Bronx, we're still in shock as to what happened. And then to be almost mocked and seeing videos of people even doubting that we've gone through this. I've spoken to people who didn't believe that we were going through this and thought it was some kind of conspiracy. So you don't even have that level of support nationwide. It was painful. So there's an emotional piece to this. There's a human piece, which I'm going to close with this. It brings me to what Rabbi Katz said. I think you hit it right in the nose, which is we got to get back to human dignity. We all were created in the image of God. Therefore, our worth does not come from others. Our worth came directly from God Almighty. He's the only one big enough to give us worth. And because he gave us that worth, we should do everything possible under the God-given power that we have been given to provide health care, appropriate health care, early on interventions to make a difference, to save life, to say to someone, we affirm your worth in the way we're going to love on you through the medical treatment that we're going to provide to you. And it's my prayer that we will learn from what we went through and that we will not have another episode. And the two questions that we need to ask ourselves now, and I've been asking from the beginning, what is the most loving thing to do? And what is the wisest thing to do? Those are the critical questions. And the most loving thing to do is to protect one another, to continue what we're doing right now. We are a model now to the rest of the United States. And the wisest thing to do is to look and to hear what our professionals are telling us, and to really adhere to what they're saying and take it serious and move into action and not just rhetoric. So I thank you. Thank you so much for the opportunity. Thank you for hearing my heart tonight.
So Miriam, should I?
Yeah, you can, we have a little bit of time. Go ahead.
So tell how much time do we have? Or I forget how much.
5 minutes. 5 more minutes.
Ooh, I don't know if you don't want to hear me for 5 minutes. Well, thank you so much, Reverend Cabrera. That's I was particularly eager to have people on this call to hear some of the stories. I had the same reaction. Like, I felt extremely privileged that I can shelter alone in my house with my wife in my house in Riverdale. But I recognize that what a luxury that is. I know it happens that a long time ago, some colleagues and I were interested in the question of household crowding. How many people live in an apartment? So we think a lot. The Bronx turns out to have some of the most densely populated blocks in New York City in terms of, how many dwellings there are, how many people per square mile. But it also turns out that the Bronx, and particularly this is true of Reverend Cabrera's district, that that the Bronx is among the highest in household crowding and what the US Census calls extreme crowding. That's having like 5 or more people in a 3-room apartment. Yeah, so that, and it's easy to, or I am privileged to only imagine this and not to have to live it. But if there are 5 people living in a 3-room apartment or 10 people living in a 4-room apartment, and one of them gets a contagious illness, a virus, it's really impossible for others to escape that. So we have this, to pick up on Reverend Cabrera's point about being wise and also being loving, by being unwise, we've allowed ourselves to disregard the needs, some would say human rights, of our fellow citizens in the Bronx. So that it's just, it seems just immoral. I have to defer on moral authority to the clergy in the audience. It seems to me, non-clergy person, immoral that there are some people who simply can't protect themselves. And so a matter of both wisdom and being loving, what I'm calling regard, is being able to take care of people in that simple way. And we know that in an event like coronavirus, and to a less intense degree, but also influenza, other kinds of infectious public health problems, if you're in crowded housing in a densely populated neighborhood, if you're deemed to be an essential worker and unable to stay home, but also not given proper protective equipment, then it is inevitable that you're going to get sick. About 2/3 of the essential workers in New York City were people of color in the coronavirus outbreak, at the worst of the coronavirus outbreak. So you can't protect yourself because you have to go to work, and then you can't protect yourself because at home you're living with 6 other people.
Indeed. If I could just interject one more point, I forgot to mention the immigrant community. They were stuck between a rock and a hard place.
Right.
You have a federal policy that says if you go and use any of the service, if you go in the hospital, we're going to use that against you. if you ever decide to go through the citizenship path. That costs the lives, literally, of thousands of people in New York City. So you have those dynamics. And as you mentioned, our good doctor here tonight, when you put all of that together, it was inevitable to have a tsunami of cases to evolve, and then it hit a critical mass, and it just went totally out of control. And let me just mention another piece, which is the mental health piece that we're going to have to grapple with. And I think, I've been thinking about this and being a person of faith, contemplating what is at the very root. My doctor is in counseling and thinking about psychologically and spiritually, what's at the very root of what we're facing here. It's hard to put your finger on it. We call it fear and anxiety and depression. Okay, it took me 5 months to finally realize I could put it in one word: despair. Despair is the absence or the loss of hope. And I think that in New York City right now, we have another pandemic, and it's a pandemic of despair that affects us well, our physical health. And this is why you see a lot of people leaving New York City because of that despair. So we're going to have to grapple with that as well.
That's thanks so much for mentioning mental health, because it's another area of tremendous disparity between white and non-white Americans. Just getting yourself diagnosed, getting proper treatment. America is terrible at treating mental problems as public health problems. We've actually been pretty good about recognizing coronavirus as a public health problem. We sort of, jumped up and banged us on the head, and we said, oh yeah, that's a public health problem. But the slow epidemic of mental illness, depression, anxiety, despair, we don't recognize as a public health problem, although in some ways it's an even further reaching one. Do you know, I'll ask the audience, what institution houses more of the seriously mentally ill in America than any other? Prisons. Our treatment system is, diagnosis and treatment system is so frayed that the way to get any recognition of having a mental illness is to get arrested and for a crime. I'm not saying that people do that on purpose. You don't get treated, you do something that gets you arrested, and then somebody recognizes you have a mental illness, but in many cases, you don't get proper treatment. And so here we have a system, the prison system, that's in which, so of the 2.2 million Americans behind bars, Black Americans are 5 times more likely than white Americans, and Hispanic Americans are 1.5 times more likely to be behind bars. And if you have mental illness and aren't being treated, you not only can't protect yourself when coronavirus comes, but you can't protect yourself when there are mental problems. In some way that's easy to see, not obviously easy to do something about. With prisons, it's less easy to see. And this is what I hear from in the crowded parts of New York City in particular, when you can't escape the grind of work, poverty, crowding, finding decent food, etc., then and then it turns out you can't get assistance with mental problems. There's another really powerful public health problem that we're also not dealing with.
And and the state could be helpful at this moment. There is a bill that I have a resolution on that would allow, you'd be shocked to know that licensed mental health counselor, which I'm one of them, we are not allowed to receive Medicaid or Medicare for the treatment of mental health issues. I mean, that's like That's like, it just makes no sense that we have a system that does not provide for that. And yet we know, like in community of people of color, that mental health counselors tend to be people of color. So we have disfranchised the people that probably could say, you know, I could, or people could say, I think you could identify to what I have gone through as a person of color. And so we need to do better. And I just hope that the will to do better is there to make it happen.
Thank you both for this very powerful discussion. It seems like we have plenty to talk about. I'm Meryl Nadell. I'm a member of CSAIR, and I want to introduce the next part of the program. We'll now divide into several breakout rooms. Each one will have a facilitator. So I'll review some of the ground rules and then some of the questions that we'll be looking at. Following the breakout rooms, we will come back together again and have time for a Q&A with the speakers. So as far as some ground rules, our goal is to create safe spaces for these conversations, which can be difficult. It's okay to feel uncomfortable. We encourage participants to take risks and to remember that what is said in your group stays in the group. We do want to be mindful of the time. We'll have about 20 minutes so that everyone who wants to speak has time to speak. You don't have to speak. It's fine just to listen, and to listen to understand, not necessarily to respond. Finally, we encourage you to use I statements, talk about how you feel as an individual. So as I said, we have prepared several questions. The facilitators have copies of them and that we thought would be helpful to consider. So the first is, if you're white, how has your white privilege helped you in being healthy or getting good medical care? If you're Black or Hispanic, how has not being white held you back from being as healthy as you would like to be? And certainly we heard some ideas from our speakers. Secondly, do you think health means something different to a white person than it does to a Black person or a Hispanic person? Third, although all New York City residents are entitled to emergency health care, those with good insurance often have many more options. What would you do if you lost your job and your health coverage, and your primary care doctor will not see you without insurance? So something to think about. Again, so I think we're ready to go into the breakout rooms, and then we'll see everyone later.
And so just as a technical note, please click Join Breakout Room to go into your breakout room. Please click on the Join Breakout Room button.
If you are having trouble finding the breakout room, you can just let me know and I can help you direct you on your screen. Deb or Davilik, can I help you find your breakout rooms?
Clear as which breakout room